I was at NIH in the Heart Institute for 32 years, and then I've been at Baylor University Medical Center in Dallas for 20 years. Is atherosclerosis reversible? I think it's important to realize that these atherosclerotic plaques consist mainly of fibrous tissue. In some work that I was involved with, we found that about 70% of these plaques, atherosclerotic plaques, consist of fibrous tissue, and then about 15% of fat and cholesterol, and 10% calcium, etc. In non-human animals, monkeys, it's been clearly demonstrated that at least the fatty content of these plaques is reversible. And some people have a lot more fat and cholesterol in their plaques than do others. So this 70% of fibrous tissue is based on 100 people, not one. It's a bit unpredictable in a single person. But it seems to me that one thing we have to remember, that it takes a whole lot of plaque to cause functional narrowing of an artery. For example, if you have a pipe or tube and you take a cross-section of that pipe or tube or coronary artery and divide that circle into 4 quadrants, one has to obliterate over 3 of those quadrants before flow through that tube, pipe, and so on, is actually diminished. So if we could keep our arteries not necessarily free of plaque, but fill up less than 75% of that lumen, the inside of the tube, pipe, artery, we probably would be home free. The problem is we can't necessarily know that we're limiting it to less than 75%. So the only thing we can do is to try to limit it entirely, in my view. I'm not sure what healing of atherosclerotic plaques is, but there's no question if one has a very narrowed coronary artery and one's total cholesterol is, let's say, 300, or the LDL is 150, and one gets that LDL down to 50 or 60, that lipid portion of the atherosclerotic plaque tends to disappear. So that lumen, the space where blood flows through, can open up. And again, theoretically, if it's less than 75% cross-sectional area narrowing, flow should be as if there was no plaque at all. You've asked, does one who is conservative regarding putting people on treadmills when you suspect there might be coronary disease, or doing coronary angiography, or doing percutaneous cardiac interventions with balloons and stents, or indeed go to a coronary bypass operation. I think one has to remember that these heart centers survive by doing these procedures. I mean, these procedures are very profitable to hospitals. On the other hand, if all of the doctors in these heart institutes preach plant diets and eliminate the meat and so on, or flesh, these cardiovascular centers couldn't make it financially. They just couldn't do it. So I'm not against these particularly cardiac catheterization procedures during acute myocardial infarction. I am against doing bypass in patients who have what is so-called stable angina, or angina relatively mild once a day. On the other hand, these procedures can be quite useful in people with unstable angina when they have it 10 times a day or they have chest pain at rest. I do think that if you take all people with symptomatic coronary disease, that if you just get their cholesterol levels from here way down to here, that would do more overall good than all the cardiac catheterization laboratories and coronary bypass. But those studies haven't been done. Texas has one of the highest frequencies of percutaneous coronary intervention and bypass in the country. Texas has 3 of the 10 most fatty cities in the country. Houston, San Antonio, Dallas. There's no question that people are healthier in California than in Texas. There are a lot of smart people in Texas and a lot of good doctors, and statins are used on a huge basis in Texas. But a lot of Texas doctors are overweight, and not many Texans follow a plant-based diet. So we have at Baylor, we have a couple of ranchers on the board. So when I first went to Dallas and started preaching the McDougall sermon, I had to understand who was on the board.